Hi, I'm Mary Rattano, standing in for Brian Lamore, who's out fighting fires. Please send blessings out to all those men and women taking care of our duties around the state. So we're going to open an edition of Pulse of St. Peter's. I had to take a check at that for just a second. Today we're going to be entertaining a guest from the hospital, Chaplain Kim Pepper. Did I say that right?
Yes.
Very good. Welcome. Welcome.
Thank you.
And today we're going to be learning about a new program that St. Peter's is putting up called the Better Breathers Club.
Yes.
Very good.
Yes.
And talking with you just a little bit before while things were being set up, seems like you're relatively new to Montana. So tell us a little bit about where you came from and what made you move to Helena.
We've been here 2 years. When I say we, that's my husband Dave and our two mostly behaved dogs, Newman and Daisy, a cow dog and a boxer. And we came from Wyoming. My husband and I were both pastors in southwestern corner of Wyoming, and we were there for several years before I came here to be the chaplain at St. Peter's Hospital.
Very good.
And we love Helena. It's beautiful, and we had long wanted to live in a town that about this size that had lots of culture and things to do.
That it does.
Yeah. So
that it does. A lot of culture, a lot of arts, and definitely your heart's desire and pick of outdoor activities,
yes,
no matter what the season is.
For sure. Yes.
Well, welcome to Helena.
Thank you.
And we're going to start right off with talking a little bit more about the Better Breathers Club. It's a new program at St. Pete's. Maybe you'd like to just start off and tell us a little bit about the ideas behind what got it started, and I'll let you take it away.
Well, as I began settling into my position here at the hospital, I began to think about ways that I could add to the care that we already offer. Lung disease has been a part of my family for about a decade. My mom had COPD, chronic obstructive pulmonary disease. My dad probably had it, but it went undiagnosed because he wasn't one that would go to the doctor.
Of course.
So we have that. And then on my husband's side of the family, 3 of our nieces and nephews have cystic fibrosis, and they're both in their teens and then a young adult. So the struggles that come with lung disease, dealing with that and addressing that on a daily basis is something that was near and dear to my heart. And as I began researching this more, we looked at the people that we serve in Helena and the adjoining communities, and we learned that about a third of the population in these areas are affected by some kind of respiratory illness, and about 15 to 20% of our hospital admissions are related to respiratory illness. So it seemed like one of those good examples of where our own passions and the needs of the area unite. And so we wanted to offer this support for the folks who face this on a daily basis.
Yeah, that's got to be really, really rough. I have a bit of asthma myself. Is that considered the pulmonary disease, or is what was the COPD?
Yes.
But say the whole thing out. What is the
chronic obstructive pulmonary disease?
Okay.
So I should say I'm not a clinical person, but when we talk about lung disease, we are talking about asthma, the COPD, emphysema, cystic fibrosis, interstitial lung disease, which I think is somewhat rarer. But any chronic ailment that causes someone to struggle with that, one of the most basic things we do every day, which is breathing in and breathing out. Right. So this group is really for all of those people. Most of our folks that are coming now do have COPD, but there's a few others that have other struggles with breathing.
Oh. So what would be an example of things that would happen at the meeting? Do they get pamphlets? Is it access to a physician, other speakers? What happens at a meeting, a typical meeting that you might have?
Typical meeting, we have guest speakers, and we've tried, since we're just new, we only had a few meetings so far, we're trying to rotate the emphasis among medical education, practical support, and emotional support. And so we'll have a guest speaker that comes in last month, Linda Robinson, who is our palliative care physician. I think she's also been a guest on this program, but palliative care nurse, right. And she also has a pulmonary certification. So that's lungs are one of her specialties. So she came and did a really wonderful presentation on the basics of our lungs, what they do, how they work, and what happens when they're not working, as well as they should. So it was a really nice, like I said, discussion, and then time for questions and answers. And next month, we are going to have one of our registered dietitians is going to come and talk about the importance of nutrition with lung disease and how that can help us manage the symptoms better. And she'll also talk, I think, about planning meals when we're ill, planning meals for maybe 1 or 2 people. And then 2 months out in September, one of our pharmacists will come and talk about medications. And one of the things we make clear with this program or these classes is that it's not designed for medical advice.
A substitute for medical
treatment. It's not a substitute for the care that you're going to get from your primary care physician or pulmonologist. But we're not there to judge or analyze or criticize, but just to support, one another. What's worked, what hasn't worked. Maybe somebody is getting ready to take their first vacation, and the first time they'll be taking their portable oxygen with them for a long time. And so, how have we managed to do that in the past?
Gotcha.
Yeah.
So, why is a support group important for people with COPD?
Well, there are the physical challenges that come with any lung disease, the shortness of breath, the frequent exacerbations. When you and I, you said that you have some asthma, so you may experience a little bit of this as well, but when someone with normal lung function gets a cold or a flu, we might be uncomfortable for a week to 10 days. We may not go to our primary care physician. We'll probably try to find relief just using over-the-counter medications and some rest. With someone with lung disease, a cold or a flu is much more serious, and it can lead to something like a hospital admission if it's not taken care of. So there's those aspects. There's the fatigue. People with lung disease tend to be a little more frail. So there's those physical challenges. There's also the emotional part. People with lung disease have frequent bouts of depression.
Sure.
There's the grief that comes with not doing the things that you might have enjoyed doing for many, many years, or maybe you can still do them, but not to the extent that you could do them before. So there's managing that. It also leads to isolation. People tend to cut themselves off from family and friends because it just takes so much energy to get up and get dressed and socialize, and it takes a lot of energy and a lot of extra breaths that maybe we don't always have. There's a little bit of that. Sometimes there's a little bit of shame. People think that maybe they brought this, upon themselves.
Sure.
And certainly all lung disease is not caused by smoking, but people who did have it caused by smoking, there's like, ugh, this is to myself. And there's the embarrassment too of, some people feel like going, especially I think with women, going out with the portable oxygen, around their shoulders can be a little bit of a hurdle, to get over.
And just knowing you're not alone, I suppose.
Right. And so the importance of the support group comes in that healing that comes when you're with people that have a common experience. I mean, certainly everybody's, everybody has experience a little bit different, but there's that common experience and that sense of community that comes when you're walking along the same path with similar struggles and similar challenges, and having been there, knowing what that's like.
Yeah, having a community of people that really understand and you can talk about it with, and make every effort to level yourself up to your best health.
Absolutely,
spot, it sounds like.
Yes. Yeah. There's a lot of encouragement that I've already seen take place among the participants. A lot of the people that come have already been involved in our pulmonary rehabilitation program, and that brings that exercise component, which is so important as well for people with lung disease, to keep yourself in as good a physical shape as you can. And so there's a lot of that encouragement, to keep trying and
stay in the game.
Stay in the game. That you might be having a bad day today, but it's not always going to feel this way.
Right.
And so yeah.
That's really good. So the meetings are fairly regular, it sounds like. They meet every Tuesday, is that correct?
We meet every Tuesday. I'm sorry, not every Tuesday. We meet
every second Tuesday.
The second Tuesday of each month
from
2 o'clock to, we say, we have the room reserved till as late as 3:30, but we usually stop around 3:15. There's always refreshments, some cookies, some beverages.
Right.
It's in rooms 2 and 3, which if you come in either the main entrance or the east entrance, it's kind of right there in the, middle between the two. So it's not too long of a walk. We wanted to make sure that we had a room that was easily accessible,
right.
For folks that, for walking is hard. I should say that our meeting in August is going to be in a different room, but if they check into the main desk, the volunteers will take them back to where it's going to be.
And that's the east entrance? Is that what
either the east entrance or the main entrance?
Or the main entrance. We'll get them to the place, and they can always ask somebody at the door.
Yes.
Do you have a website that people can look up to get more information or to track what's going on a monthly basis?
They, I don't think that's on our website yet, so thank you very much. But they can always go on the St. Pete's website, stpetes.org. The Better Breathers Clubs are a function of the American Lung Association, and these are nationwide groups. So even if they're out of town, if they feel like they want to look up a group, they can do that. And they can go on the, I think it's ALA.org, and they can, enter see the link for the Better Breathers Clubs, and there's more support there as well.
So if they run into just some need for encouragement, or maybe even if they're vacationing someplace and they would just like to see what the speaker had to say there, more education opportunities then.
Yeah.
Very good. You said it's part of the American Lung Association?
Yes.
And tell me a little bit more about how that organization, are they sponsoring this through St. Pete's, or is St. Pete's sponsoring this, or how are they?
We're both sponsoring it. I took their training to be a facilitator.
Oh, very good.
And so yes, we've signed an agreement. So I guess you could say that they're sponsoring it, but we're administering it. Yes.
Very good.
Yeah.
Very good. Is there a cost to the?
There's no cost. It's free, and anyone can come. It's open to anybody to come at any time. And like I said, we've already had we had new people come this last time, and we have about maybe 12 to 15 people participating, and that's a good size. So we're hoping that we get big enough that we can have more than one group.
Right.
And it's been it's just really been I've enjoyed it a lot.
Good.
Meeting
good.
People and learning from them too.
Well, absolutely. Yeah. We learn from everybody and everything. So the next meeting is Tuesday, August 12th at St. Peter's Hospital.
Yes.
And could you repeat one more time what the topic is going to be for the next meeting?
Yes, Jennifer Callgrove, who's one of our registered dietitians, she's going to be coming and talking about the importance of nutrition with managing our lung disease. So I don't know that it's going to be a thing of like don't eat salt and things like that.
Right.
But right. But it's because also with folks who have lung disease, keeping ourselves hydrated and keeping some nutrients in is good. So,
yeah, absolutely, absolutely. I think we've just about covered everything. Is there some other things you'd like to punctuate about the Breathers Club that you'd like people to remember?
Just that this is a really supportive environment for people to learn from one another, to support one another, to offer encouragement, and to, sometimes there's not answers to the questions that we have. Right. And so just to be together in the struggles of this on a daily basis, we want to make sure that we support people in that.
Encouragement and support.
Yeah.
Well, excellent. Thank you for joining us today. I really appreciate you educating us on the new program that St. Peter's is putting up. It's already up, right?
Yes, it is.
It's already up. So you've had a meeting or two?
Yeah, we have. We've had two or three meetings so far.
Good. Yeah. Good. Well, excellent. Thank you for joining us today.
Thank you so much.
And thank you, too, for joining us to learn a little bit more about the Better Breathers Club that St. Peter's Hospital is offering. Please feel free to visit their website to get more information. And right there on the screen is a little bit of a last-minute flash on when the next meeting is going to be held. So take care and have a beautiful day.